Indonesia was one of the first developing nations to launch a COVID vaccine drive. But that early push has started to falter, bogged down by geography and logistical problems. That's forced the government to get creative, taking the vaccine directly to those who need it. But it's not just people's lives that are at stake. COVID threatens their livelihoods as well. Poverty was already spreading here before COVID shocked the system. But now it has created fresh economic divides, leaving many wondering how to put food on the table during a global pandemic. This is your COVID-19 special on DW. I'm Janelle Dumalaon. After weeks of a surge in COVID-19 cases, the spread is now slowing somewhat in Indonesia. But the country continues to struggle with the worst effects of the pandemic, growing inequality being just one of them.
The pressure is on. Indonesia aims to vaccinate 1 million people a day. And since the arrival of the Delta variant, everybody here is keen to get the jab. Among them, Dimas and his family. The pandemic has hit thousands of low-income families like his particularly hard. He used to have a small shop in Bekasi, just outside Jakarta. We now have nothing left. I was made redundant and now we're effectively bankrupt. We're trying to find a way out. My wife is baking and tries to sell homemade cakes online. Indonesia began its COVID-19 vaccination program this January. Using vaccine components from China, Indonesia has produced 185 million doses of the Sinovac vaccine to date. The country has also received over 19 million vaccine doses from the United Nations-backed COVAX initiative. With a number of new infections sky high across Indonesia, vaccine skeptics have become hard to find. I don't want the vaccine because there's so much bad news about it. I'm just worried for my health. A lot of my friends got sick after being vaccinated, so I'm afraid. To stop rumours about exaggerated side effects, the government has started an information campaign. The Ministry of Health is determined to vaccinate 70% of the population from the age of 12 by the end of the year. If you don't believe that COVID is real, just come to the hospital or the cemetery and help the officers bury people without protection. In a viral video, two self-proclaimed healers did just that. The two visited COVID patients a few months ago in order to prove the disease is not dangerous. Both of them died a few weeks later. There should be more sympathy with the victims. We need to acknowledge the enormous death toll worldwide, and particularly in Indonesia. Among them are many of Dimas' friends. He's glad to have some protection now. In 1 month, he will receive his second shot.
Aloysius Gunadi Brata is a lecturer in economics at the Atma Jaya Yogyakarta University. Welcome to the program. We're hearing of overloaded hospitals, deaths, and destroyed livelihoods. Can you tell us how bad it really is on the ground?
Yeah, actually, after the government implemented several lockdown measures and other physical distancing, of course, still continues, yeah. But bed occupancy rates, BOR, now according to Ministry of Health, yeah, in all provinces is lower than 70%. Yeah, so it indicates that hospitals are not overloaded again. Yeah, but and specifically yesterday, this bed occupancy rate is 29%. Yeah, but in some provinces, yeah, especially in Sulawesi, Sumatra, and Kalimantan, are still above 50%, indicating that now the problem outside of Java Islands is still serious. Yeah, and regions in Bali and Yogyakarta province are still under lockdown level 4. Yeah.
Right. Now, we also want to talk a bit about the economy. How have people who work in the informal sector been affected by the pandemic?
Yeah, we know that before this COVID-19 pandemic, actually, maybe more than half of Indonesian workforce, yeah, they got their income from their activities in the informal sectors, yeah. And these sectors is really known that always face vulnerability in terms of unsecure job, is also unstable income, yeah. And most of the poor are in this sector, yeah. So when there is a strict physical distancing and all lockdown measures, yeah, this directly affected the daily activity of this informal worker, such as street vending and also transport drivers, yeah. So they face difficulty to get income, yeah. Yes,
Right.
actually we
So
don't have, yeah, okay.
the pandemic is disproportionately affecting the poor and those who work in the informal sector. But does the picture differ depending on whether we're talking about rural or urban areas?
Informal sectors, yeah, mainly exist in urban area, yeah, and people from rurals, yeah, they move to the city in order to find another jobs, another life, something like this, yeah. And when something happened like this, a very strong shock, yeah, they have no sufficient support. And one important thing that it's very difficult to reach this worker is that informal worker is not fully recorded by governments. Yeah, so when government try to help, for instance, to provide subsidy, for instance, there is a problem with administrative matter, for instance, the ID, the location, something like this. Yeah, so it's difficult actually to know the rate of the income fall, but one study indicates that at least now their income already drops maybe 80%, yeah, since the start of this pandemic.
So there are bureaucratic difficulties involved in getting aid to especially informal workers and the poor. But I also wanted to ask about Indonesia's vaccination strategy. It, of course, differed from that of many other countries in that the younger working population was vaccinated first as opposed to the elderly. Given what we know today, was this the right strategy?
Actually, it's difficult to say this is a wrong strategy or a bad strategy, but in my opinion, yes, the number of vaccines is very limited, yeah, because we know that Indonesia is not the producers of these vaccines, yeah. So the availability of these vaccines really affect the available strategy, yeah. So available strategies, I think, is very limited, yeah. So although maybe it is not a very good strategy, I think it's already a good step, yeah. And basically, the government tried to distribute these vaccines, yeah, into 4 steps. Yeah, the first for worker in the health sector, and the next for the old people and other public servants, including police, journalists, and teachers. Yeah? And the last is other groups. But since a few months ago, the targets
I'm sorry, that's all the time we have for you, so sorry to have to cut you off there. But Aloysius Gunadi-Brata is a lecturer in economics. Thank you very much. Time now for one of your questions. Over to our science correspondent, Derrick Williams.
My son refuses to be vaccinated because he says none of the vaccines are 100% approved. How should I respond?
Well, you can start by telling him that the Pfizer-BioNTech vaccine is now fully approved, at least by the Food and Drug Administration in the U.S., for those over 16. It received that designation earlier this week, more than 9 months after it was approved for emergency use there. Other vaccines authorized for emergency use or conditional use in the U.S. or in other countries, they still have to clear final hurdles to full approval. So why does it take so long? Well, before issuing full approval, healthcare regulators take a really exhaustive look at how the vaccines have performed in real-world conditions and whether they're living up to the promise that was only indicated in clinical trials. But regulators actually do that kind of deep dig down for every new medication or vaccine. So the fact that it's taking time for pre-authorized vaccines to receive full approval isn't really a surprise or an exception. More than 5 billion doses of vaccine have been administered globally so far. And although some rare safety issues have been spotted for different vaccines, that's actually a good thing because it means the system is catching the warning signals that it was designed to detect. Pretty much everyone who's vaccinated, I guess, has by now argued with someone who's skeptical about vaccines. And it's an issue that has destroyed plenty of relationships. So any discussion with your son is certain to be fraught, Francisco. But I guess the one thing I always try to communicate clearly is that full approval is slow to come, not because I think authorities like those at the EMA and FDA are really hesitant or doubtful about the safety and effectiveness of pre-approved vaccines at this point, but because they're being extremely thorough, which is really exactly how we want them to be.
Thanks for watching.